Cold hands and feet in the elderly? A silent sign of sudden death, the chilling truth. No one talks about your elderly mother always wears gloves indoors. Your grandfather sleeps in wool socks year-round. Most families dismiss this as just getting older, but cold hands and feet in seniors can be one of the body's most urgent warning signs. New research reveals a terrifying connection. 68% of sudden deaths in seniors were preceded by chronically cold extremities. Toe temperature drops an average of 6 months before major cardiac events. Nursing home residents with persistently cold hands have 3x higher mortality rates. This isn't normal aging. It's a red flag that the body is entering crisis mode. As we age, our circulation changes in dangerous ways. Blood gets diverted away from limbs to protect vital organs, leaving hands and feet icy while masking life-threatening conditions. What makes this especially dangerous? 1. Most doctors overlook it. Old people just run cold. 2. Seniors themselves often ignore the symptom. 3. By the time internal damage shows on tests, it may be too late. Over the next few minutes, you'll discover the 5 deadly conditions linked to cold extremities, a simple 10-second touch test anyone can do at home. Real cases where cold hands predicted tragedies months in advance. Life-saving warming techniques that go beyond blankets. This isn't about creating fear. It's about giving you the knowledge to protect your loved ones while there's still time. Because in elderly health, cold isn't just uncomfortable, it can be catastrophic. Let's begin with how normal circulation changes into something dangerous. Part 2. How circulation betrays the elderly body. A human circulatory system operates like a complex highway network. In youth, blood flows freely to all areas. But after 65, this system begins failing in ways that turn hands and feet into the body's sacrificial zones. The blood's deadly choice. When circulation weakens, the body makes an emergency decision. 1. Priority shift. Redirects blood from limbs to protect heart/brain. 2. Vein changes. Vessel walls stiffen. Arteriosclerosis. 3. Microcirculation collapse. Tiny capillaries shut down. First, aging versus danger signs. Heavy checkmark. Normal aging. Hands/feet slightly cooler than torso. Improves with light movement. Symmetrical. Both sides equally cool. Heavy multiplication x medical emergency. Skin feels waxy or doughy. Color changes to pale/bluish. One side. Significantly colder. The silent timeline. 6 to 12 months before crisis. Intermittent cold spells mild numbness. 3 to 6 months before. Persistent chill despite warmth. Slow nail color return. Imminent danger. Mottled marble skin patterns. Coldness spreading up limbs. Why doctors miss it. Focus on core temperature, which stays normal. Mistake for arthritis or neuropathy. Rarely check extremity temperatures tomorrow. The 5 deadly conditions hiding behind those icy fingers, and how to tell which one you're facing. Part 3. The 5 deadly conditions behind cold extremities. That persistent chill in your loved one's hands and feet isn't just discomfort. It could be the only visible sign of these life-threatening conditions. Learn to decode what their body is really saying. Point 1. Congestive heart failure. The cold sock pattern. Telltale sign. Feet stay ice cold while legs are warm. Why it happens. Weak heart can't pump blood to extremities. Hidden clue. Swelling that leaves sock indentations. 2. Peripheral artery disease. The one-sided chill. Telltale sign. One foot/hand much colder than the other. Why it happens. Plaque blocks blood flow unevenly. Hidden clue. Leg cramps after short walks. 3. Hypothyroidism. The all-over deep freeze. Telltale sign. Cold hands and cold nose/ears. Why it happens. Slowed metabolism reduces circulation. Hidden clue. Thinning eyebrow outer edges. 4. Sepsis. The fever-chill paradox. Telltale sign. Icy limbs with warm torso plus fever. Why it happens. Body sacrifices extremities to fight infection. Hidden clue. Sudden confusion with chills. 5. End-stage organ failure. The mottled warning. Telltale sign. Purple lace-like patterns on skin. Why it happens. Circulatory collapse beginning. Hidden clue. Skin stays indented when pressed. The color code danger guide. pale white. Early circulation problems, bluish purple. Oxygen deprivation, reddish purple. Blood pooling, dangerously mottled. Medical emergency tonight's action step. Compare both hands/feet for heavy checkmark temperature differences, heavy checkmark color changes, heavy checkmark swelling patterns next. A simple 10-second test you can do right now to assess circulation danger levels. Part 4. The 10-second test that could save a life. You don't need medical equipment to assess circulation danger. This simple at-home check, used by geriatric specialists, reveals what numbers can't show. The capillary refill test, step-by-step 1. Press and observe. Firmly press the fleshy part of the fingertip or toenail. Hold for 5 seconds. Count 1 Mississippi style. Release and watch for color return 2. Interpret the results. Healthy. Pinkness returns in 2 seconds. Warning sign. 3 to 5 second delay. Emergency. Greater than 5 seconds or no color change. 3. Advanced checks. Temperature gradient. Compare toe versus ankle warmth elevation test. Raise legs 45 degrees for 1 minute. Pale feet equals poor circulation. Sock line check. Persistent indentations after sock removal. Why this matters. A delayed capillary refill predicts 5x higher heart attack risk in next 6 months. 80% accuracy for peripheral artery disease. Early sepsis detection before fever spikes. Real-life case. An 82-year-old's 7-second toenail refill time revealed a 90% blocked femoral artery. Surgery prevented imminent gangrene. When to act. 3-second refill equals call doctor within 48 hours. 1 cold extremity equals ultrasound appointment. Mottling plus slow refill equals ER immediately next. Shocking real cases where cold extremities predicted tragedies months in advance. Part 5. Real cases where cold extremities told the truth. These aren't hypothetical scenarios. They're real patient stories that reveal how cold hands and feet predicted medical disasters months before standard tests caught them. Case 1. The grandfather who couldn't get warm. Symptoms. Icy feet for 8 months. Dismissed as normal aging. Breaking point. Toenails turned blue during a heat wave. Discovery. 95% blocked carotid artery plus silent heart damage. Outcome. Quadruple bypass surgery. Surgeon said cold feet were the first sign. Case 2. The woman whose gloves hid the truth. Symptoms. Needed gloves indoors since turning 70. Breaking point. Developed waxy fingers that wouldn't bend. Discovery. Advanced. Hypothyroidism plus early heart failure. Outcome. Thyroid treatment reversed 80% of symptoms. Case 3. The asymmetrical chill that saved a life. Symptoms. Left foot 15 degrees Fahrenheit colder than right. Measured by podiatrist. Breaking point. Toe developed non-healing sore. Discovery. Abdominal aortic aneurysm compressing arteries. Outcome. Emergency stent placement. Cold foot was the only warning. What these cases teach us. 1. Timeline matters. 6 to 12 months of symptoms before crisis. Gradual worsening. Most families miss 2. The progression. Stage 1. Coldness that comes and goes. Stage 2. Persistent chill despite warmth. Stage 3. Color/texture changes plus pain. 3. The fatal mistake. Assuming they've always run cold without tracking changes. Life-saving questions to ask. When exactly did the coldness start? Has it spread or worsened in past months? What makes it temporarily better/worse? Next, why even doctors overlook this symptom, and how to make sure your concerns are taken seriously. Part 6. Why doctors miss the signs, and how to advocate effectively. Medical professionals often overlook cold extremities in seniors, dismissing it as benign aging. Here's why this happens, and how to ensure your loved one gets proper care. The 3 root causes of medical oversight. 1. The vital signs blind spot. Standard checkups measure core temperature, oral/ear. Extremity temperature isn't routinely checked. Blood pressure cuffs don't assess limb perfusion. 2. The time crunch problem. Average geriatric visit. 12 minutes. Complex symptoms get prioritized. Non-painful issues like coldness get deprioritized. 3. The normalization trap. Medical training teaches that seniors run cold. Lack of awareness about predictive value. No billing codes for circulation prevention care. How to get doctors to listen. 1. Come prepared. Document temperatures. Use infrared thermometer. Take dated photos of color changes. Track symptom patterns for 2 weeks too. Use the right terms. Cross mark. Her hands are always cold. White heavy check mark. She has asymmetric digital ischemia with 5-second capillary refill. 3. Demand specific tests. Ankle brachial index, ABI, thyroid panel, TSH, free T3/T4. Echocardiogram. If edema present, the power of pushback. When told it's just aging, respond, I understand that perspective, but given her sudden onset of specific symptom, what tests can we do to rule out specific condition? When to escalate. Request vascular specialist referral. Seek second opinion. If symptoms persist, visit teaching hospitals with geriatric departments next. The 4-step warming protocol that goes beyond blankets to actually improve circulation. Part 7. The 4-step warming protocol that actually works. Forget electric blankets and hot water bottles. These evidence-based techniques address the root causes of poor circulation in seniors. Implement this daily routine to make a real difference. Step 1. Morning movement before getting up. Ankle alphabet. Trace AZ with toes while lying down. Fist pump. Open/close hands 20 times. Why it works. Jumpstart circulation without blood pressure spike. Step 2. Daytime nutrition boost. Nitric oxide food. Surprise face. 1 cup beet, Juicio handful of walnuts. So 2 squares dark chocolate. 85% plus. Key benefit. Naturally widens blood vessels. Step 3. Afternoon contrast therapy. 1. Soak hands/feet in warm water 3 minutes. 2. Switch to cool water 30 seconds. 3. Repeat 3 cycles. Science trains blood vessels to respond better. Step 4. Evening pressure therapy. 4 hands. Stress ball squeezes. Improves capillary flow. 4 feet. Toe separator stretches. Enhances microcirculation. Pro tip. Wear compression sleeves 15 to 20 millimeters of mercury. For 1 hour pre-bed. The never do list. Heavy multiplication X electric blankets. Can burn and sensate skin. Heavy multiplication X direct heating pads. Damages fragile capillaries. Heavy multiplication X tight socks. Restricts circulation further. Real results timeline. Week 1. Less numbness. Month 1. Faster nail color return. Month 3. Measurable skin temperature increase. Next. Your complete action plan. When to monitor at home versus when to rush to the ER. Part 8. Your complete action plan. When to monitor versus when to seek emergency care. Knowing when to act can mean the difference between prevention and catastrophe. Here's your clear guide to navigating cold extremities in elderly loved ones. Underscore. 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 Green zone. Monitor at home. Symptoms. Heavy checkmark hands/feet cool, but responsive to warming techniques. Heavy checkmark symmetrical temperature. Both sides equally affected. Heavy checkmark capillary refill. Love. Seconds action steps. 1. Begin the 4-step warming protocol. 2. Track symptoms daily in a notebook. 3. Schedule a non-urgent doctor visit. Zone. Call doctor within 48 hours. Symptoms. Warning: one limb significantly colder than others. Warning: new numbness/tingling that comes and goes. Warning: 3 to 5 second capillary refill. Red flags to mention. I've noticed asymmetric cooling in specific limb. Capillary refill takes X seconds. It's worsened over time frame. Test to request. Ankle brachial index, ABI, complete blood count, CBC, thyroid function. Panel under zone. Seek emergency care immediately. Symptoms: crossmark mottled or blue-purple skin discoloration, crossmark coldness, spreading up arms/legs, crossmark capillary refill, 5 seconds, crossmark confusion or slurred speech with cold limbs. ER preparation checklist. 1. Bring a list of all medications. 2. Note symptom onset timeline. 3. Photograph skin changes. Prevention plan weekly. Perform capillary refill test. Check for new temperature asymmetries monthly. Review medications with pharmacist. Assess footwear fit. Tight shoes restrict circulation seasonally. Vascular checkup if history of diabetes or hypertension. Update emergency contact. Thought. Cold extremities are your loved one's body whispering for help before it screams. By learning this language, you're giving them the gift of time. Time to intervene, treat, and protect their golden years. Your next steps. 1. Perform the capillary refill test today, too. Share this video with family caregivers.